about the doctor that I went to actually see, a female doctor, and she looked at me and said, "Oh, this is your age and this is your size. Do you know that you're going to die soon? Are you going to die because no one's going to like you or love you the way you are?" I'm here to call out some set of people, and this particular people are under medical. They're medical professionals, the nurses. You guys are rude. They're fucking rude. You guys lack empathy. Tell me why I went to the hospital yesterday, and before you get to the doctor, you have to check your vitals and your blood pressure and stuff like that. And I went, someone hasn't checked anything. But the only thing she has checked was my blood pressure, and immediately she checked it. She asked, "Oh, do you take these drugs?" In my head, I felt like there was something wrong. Oh, she was saying something really wrong. I was even scared. I said, "No, I'm not." And she was like, you look like someone that takes hormonal drugs because you look abnormal fat." But at that point, I couldn't even say anything. I just kept quiet because I was so founded. I don't know how I felt because as someone that has grown thick skin, towards body shamers or people that call me fat, at that point I didn't really care. But imagine someone that has grown this thick skin, imagine someone that's still going through, as someone that's still going through low self-esteem. What do you want the person to think? Because I was even thinking something was wrong. But you wanted to.
I think aside from even people having low self-esteem, like you are a professional, you are a nurse or a medical doctor or a health practitioner. That should not even come out of your mouth. You look like someone that takes hormonal drugs. You're not only body shaming, you are you are not professional. That was rude, that was disrespectful. There's so many words to quantify that behavior. And sadly, it is very, very common. Sometimes that me, I've experienced something, not something similar to this, but in a different version. And most time when I go to the hospital, either with someone or alone for my own personal reasons, I don't say, oh, I don't present as a medical doctor. I just go, let me even see these people's service. And you see sometimes nurses, the things that they say, even some doctors, the things that they say, male doctors, female doctors, the words that come out of their mouth, there is no empathy, there is no remorse, there is no feeling, nothing, as if you're a robot, as if there's so much wickedness and heartlessness. I'm so sorry, but it is the truth. So many people might be going through, for example, they might even be dealing with PCOS. She might be having one hormonal imbalance issue. She might be having endometriosis, for example. There's so many things she might be dealing with. It's possible she has been even been struggling. Like if you listen to her, she said she has grown thick skin. Why? Because of the amount of abuse that she receives, or insult, or backhanded comment, whatever it is she receives every single time. I imagine getting that from someone that is supposed to be getting help from. It is really sad. And I think in this year, 2026, we need to really change. Healthcare workers, we need to change. We need to stop body shaming, criticizing, and making people feel uncomfortable when they come to the hospital. It is a terrible, terrible, terrible behavior.